Dem, me de to so. Hello, everyone for your mama kwaba eba the Gawa Hour Jumedi and so within the Tina Sarpong, the host of the Gawa Hour. And we're gonna be talking about depression. Any depression when you're ready na NTBA no Jumedi no ebeshishe so. But just so na was program no ede amame share program no na unia emenye bintie obi amra no betie bi na afei nso de ekoso e wo yabrabo mu depression what din ya ba ebia na unim de ye frɛ no depression nti momra na metwetwe nkomo sisi a. Once again, I'm Tina Sarpong, the host of the Gawa Hour. Please share the link and let's go. Before that, I'm going to take a quick commercial break before we start. So share and let's go. Aye, nti se wa baswa na odi wa share na wa invite you bi na obi so invite you bi na ya de dwumadi no ahyehye so. Nti ebusiafo said ye no de bia no de Gawa Hour dwumadi no e na wasugu so a utie no. Nti momrai na ya metwetwe nkomo ya betwetwe apomuden ho nkomo na bi sa se apomuden ho nsem ete say ene me ne yen sister Juliana Domfeh ene betwetwe nkomo yen sister physician's assistant bronze care obecheche nsem wani bebre nti monyemre na enche bia di dwumadie no hyehye so ai nti the Gawa Hour dwumadie no ena wasugu so a otie no apomuden ho nsem ete say ansa na no kwakwaja aboafo nkra so abasisi ya na di dwumadie no ahyehye so dwumadie omomafa ho ka our cares organic mixtures se opinku papa asra ama radio no atoso a eno ane our cares is if oda dadwin na I wo skin ho bedan no na obeboa ama wo skin no atoso kama nti no ebusuafo se opinku papa asra our cares ena me kanfo e dia ama ti me basisi ya. Said ye no said ya meka no upenku a ebe ma already no atoso kama and fa wani enchire baby a for our case e wo 9178363155 na kwaje ode na fasra e ma already no entoso na ha e ma busanfo mun share program no e ma yensisi a na afi no me fa akwanya we so ama yen sister Edith Davis and Jacqueline Adokwe a happy birthday se nyame ye wadom no de mfie ba ko e ka mfie ho a e nshira nko a nti anope enwumre nshira e na mesrema yenuanom sister Jackie and sister Edith Davis nyankopon ka mo ho no fa mfie bebre enka mo mfie ho wa wonso this month here and I said na your birthday also you my happy birthday sister Juliana you my kwaba eba the Gawa Hour dwumadi ne so
me that's it
na mpomo to say
nyame adom ye bebre
yo ya da say ya to nsafro waja wadaje ho na oba bebo the Gawa Hour dwumadi no do you know answer be shase no we my a brief history about yourself baby I shall see fi na wa ba be physician's assistant say ka say physician's assistant e dey na oye ne sa nti
okay. All right, send you CD kan me the Juliana na me a PA. I've been a PA for about 16-18 years now. Now you can also be a physician assistant. We pretty much work with MDs. We diagnose, we treat, we do complete physical, we prescribe. We pretty much be doctors name under the supervision of a physician. In the past years, I work in different specialties, paper. It been a psychiatry, medicine, GYN, emergency medicine, and right now I'm doing general surgery and urology, bronze care. I'm really happy to be here. Thank you.
Oh, thank you so much. And I say, and I mean, fee na me sa aka me prescription cry some do fie. And bibia me here bi and no matter what you dey na say. And no ana major answer mako. Inti and your topic no depression and anxiety. E be say for me pamcho mun share program no emfama yen. And inti and depression and dey ba share na nyame adoma next week no the anxiety about beto aso. Inti say ka say depression na e dey na ye pa kire. Then a depression eba and I say obeda no who say obi e depression.
Oh, okay. And sana your best starting a crown. Me pesa me di disclaimer eto. Say where educational purposes. Inti se wo symptoms bi a yeke can be cra. Na se bibi ya we so ko hu primary care doctor and na say your psychiatrist e man diagnose you. This is not anything to diagnose or to treat. For educational purposes onko. And watching on your mechanic say said depression and shed any ye a bibi memontino. West nibi wa nika adding a would trim intino, samantimi and canny tree and yes say a yame boapaye, name more fan cheme. Now, or question be asked so I bit me a busana, may me best breaking it down. Now, and yet 10 biano meet me a canny trim. Inti ya can say depression a mood psychiatric mood disorder a cause affecting how a person is feeling senior wa boom attitude how you think senior what journey how I will handle any daily activities such as who's order who did or quadruma depression and yet any just weakness just like your high blood pressure and your diabetes and depression so your illness so wunya e was so timiko hu medical provider now or diagnose you now or treat it. You know, there is millions of people currently. CDC, MIA who say about 16 million adults are living with depression. Now, see, the nipens near age now, 1 out of 6 with depression. So, a very common illness among us all. And depression could affect anybody. It affect no matter your gender. So you're ba, so you're bema, so you're bruni, so you're tuntum, so you're kola, so you're penny. Depression it may affect you. Now it affect you. It affect how you feel, how you think, how you handle everyday activities.
Okay. Inti me fa ne se me ni obi na wo honom na me sha ebia nipa no enkane na nkoye active okay kan ho ne me all of a sudden na say wate ne ho bi ana say ase enema enhye da enkoye sa eno no me metimi aka say nipa we go through depression ana say ana metimi atu no for say onkonko hu doctor na say bibi koso e wona brabo mu.
Okay, so answer na me answer eno no me pese me hu what causes depression. So scientists or research me who said there are a bunch of factors that could cause depression. Benny said it could be biological, it could be social, it could be psychological. So yakasa biological, it means it could be something genetic, hereditary. And to say it be a mommy first degree a relative, say your mommy, say your papa, say a ye wuniano, depression. You have a high risk of getting it. Say, and I also say biological could be brain chemistry, something like neurotransmitters. Say your brain, you are these neurotransmitters, are your chemicals. It be say serotonin and dopamine. Say these levels near low, your brain one, am I falling into depression? Into say you're low now, you could easily get into depression. Certain things like stresses in our lives. Like say obi go through divorce could fall into depression. Say obi go through say a car accident nipa ni timinya depression. Say anasin some so obi nya any medical illness say bibi say cancer, kidney disease, kidney failure, anasin stroke and a heart attack and also so etimi cause depression ewo nipa ne life. Inti say symptoms of depression say starting a busai say na obesi who say we depression. So normally we were depression you the first thing you feel sad, you feel like outburst of irritability. I saw who you be we want to send you away and I say you lose interest in things that you love to do. But say we sleeping habit. Either say we sleep that be brave, and I say nakra, and I say you may feel tired. Also I say what broso. Also you might have slow in thinking. I say what junior so you might feel trouble even in thinking. Your thoughts so, and I also so you feel empty. I said there is no hope, and there is no. You feel more sad.
Okay, ebusia for se waba so na meka wo se the gawa awa dwumadi no na waso gu so no ene ye ne yen sister Juliana Domfeh a oye PA e wo Bronx Care na e twetwe nkomo efa depression ho. Nti no se waba so na wa share dwumadi no e de ama yen sister Betty Biden also o share yen na nanadwa achimamansa also o share yen. Nti se what are the common causes? And I said, "Dear Ben, etimi emane basa se obi etimi enya depression."
Okay. So, send me can the first thing could be hereditary. Say, oh me and now papa now unuanom depression, you are a risk of factor for getting depression. And I say neurotransmitters, chemicals be what your brain anymore. Say when the levels fall down, you could easily fall into depression. Bonse or why and I say ho na o dabi bray and I say o nakra and I say o didi broso and I say obi also so only di cry and I say you will lose appetite and I say o thought and the way you are thinking in sisuye now fe asa ho ye bisebi irritable na also so asa obu afu and I said things you would normally love to do. Obi wo ha na be or pe shopping or pe going out to church or pe going out to work. Na feel onye any of those things in the Caribbean. Inti we no mu nyina etimi ema hu say you are depressed. And also there are different kinds of depression. Depression be wo ha it could be perinatal or postpartum depression. And oh yeah, say be or before obi or nyem and answer wa awie no. Nipa ne ho kama, but it's or wo wi a afi now are falling into depression. Now on one background po on peso be pajan. Utimi hu say niema na she loves to do no. She no more get interest in doing it. Afi and nya say and not just say we are quadro name na depression go through postpartum depression. Another depression is also persistent depression. This type of depression, it may cause for at least a year or two. And Tubon said, even this, if Oboha, they are able to do daily activities on and off, but at the same time, they feel very depressed. They're not themselves. They frequently sleeping. They frequently getting tired. They getting upset easily. Little things that they enjoy doing, they no more doing it. And major or clinical depression. So you're diagnosed with major or clinical depression. It was so when you have these symptoms for at least 2 weeks. Now, and sana yebeka how we diagnose depression in a minute.
Come maybe say
Also, so like go ahead.
So for so aba so na wa share dwumadi no ede amaye na ansa na no meje aboafo nkrat so ede aba emprepi ne ya na meka ne nyina abomu na ayese commercial ne ya do so achen ejum ye topic no intimate say no me break commercials ne down inti dwumadi so nyame adom a April 6 Global Mothers Touch almost say ayemra ne ameboa na enkola a omo eho aka ese ebia obi oho no ma woni boafo a o hye no ye ayemu akakra ene de beboa nti nyame adoma April 6 ye nyina ye de ni echiremu ewo 3586 Boston Road. Mpamocho, yemra never support to this good cause. Last year, mekoyena it was amazing. This year, no, so upe VIP ticket $100 and a regular stand no $70. Into no one say obe free 646-465-4384. 646-435-4384. No ajo de utimi yes utimi cash up. And I say so friend number that you busy. I'll be to me a friend 929-331-8560. Ofra. What you say on crowd to ticket no na fire donation efama obi. Yen sister to ne ho asi ho no mo say sebe nkola omuni boafo e na ono so oboa. Kakra yen so me no ye betimi de aboa ene say beto ticket ne bi na yakọ support dwumadie no. Your friend Global Mothers Touch. Afen so osan wo enema ye beton no wase bia wo panhwene bi de agugu wo nsa ne wo nan a sa ne me nyina bi ebeba dwumadie na se. Nti wo kwa obenya enhwene a eye kama na wato bi e de agugu wo nsa kama na ye de aboa dwumadie no dwumadi a wafa to no ho adwuma ne so ye nyina me no ene ebeboa ama dwumadie na ode ato ne ho so no akọ animu nti akola bi ohonom a nanka obetimi akọ school no so mpaboa anase bag anase atade akọ de ikọ school no na eho asem eyeden eno nti na yen sister ede ato ne ho so the CEO of Global Mothers Touch sister Nidia, yes, said the name of a lovely queen, or say yen I am wa, na yamfa, Jumedia, Edana Kumasu, Yemesum, Eman. Until April 6, yen idea need trimu, 3586 Boston Road, na Yakakoboa, Jumediano, Messiam or Honum. To be answer tickets, no. Regular stand $70 and VIP so $100. It was for say afi na waba so a nkomo a twetwe na depression yene sister Juliana Domfeh na twetwe nkomo wa cheche yen bebre nti na sister Eka say depression doesn't have gender. Does depression affect young adults too?
Correct. Depression does affect young ones too. And as a matter of fact, depression affected women more than men. Obi Bebusa say I didn't think it affected women more than men. Because in prep, and anything goes wrong, are more likely for medical checkup than men. Also, women are able to express themselves emotionally, psychologically easier than what men do. So in so doing, we do have statistics and data easily on women than we do for men. So depression does affect kids, it does affect teenagers, it does affect everyone, but it normally affects women more than it affects men.
Women, you see, depression affects us more than men. Madam Fubia Menino, you're tiding come up. Also, me depression, but not shopping. I make you. Can you solve that? Shopping, just like or no in her mind, I feel say no na Emma or feeling okay. And ube friend if you say me was store into one and the misunderstanding near my baby na what on what are you doing with these things? And I say I'm going through a lot, going to the store help me cope. Is that also like a sort of behavior? It has something to do with the depression because or not I said be depression.
Yeah, that is true. So that form of depression, it could be a combination called bipolar. There are times they will fall down, not do anything, and at times it's called manic episode. So they will be shopping or be kakra than accounting. Otimi kofa e de shopping mo bia and also what checkra into it is a form of depression but in a different form, a manic episode. Yeah.
But your treatment be a hormone for depression, Yana.
Oh yeah. So Ansani ever can say about depression. Me person me can how do we diagnose it? And to diagnose depression, medical provider, first of all, can some blood work to make sure say there is no any other medical illness going on. Mostly thyroid could mimic depression. Tisa year no free why and sana be diagnosed no ye used to be called DSM-5. DSM-5 is a classification categorizing mental illness. And Sanya by diagnosis, you should have 5 symptoms. Those 5 symptoms, loss of sleep, loss of interest in pleasure, sleep disturbances, even tiredness, eating more than usual, sleeping more than usual, trouble thinking, frequent, upset, irritable. So all these symptoms, it was at least 5 of them. Out of that 5 of them, 1 of them should be change in mood or loss of interest. And all these symptoms should go on for at least 2 weeks. And ansani be diagnosed, at least all these symptoms, should have persist for at least for 2 weeks. Ansani etimi a diagnosed. And that could be say diminished ability to think. So I know also I know I is slow. We shane before now kind of home, but it's answer or depression when it's not feel why is slow. Now obu also so depression symptoms could be they easily gaining weight, they eating more than usual. Now o didi no didi ontimi control ne ho. But all these and Sanya be diagnosed again, you should have 5 symptoms, and those 5 symptoms, one of them should be change in your mood, and change and loss of pleasure or loss of interest in things that you used to do. Treatment, I think you asked for treatment. Treatment, the first thing that normally we do for depression will be psychotherapy, or which is just a form of counseling. Counseling or healthcare provider, they basically will do some counseling or psychotherapy. It's another form will be talk therapy. Say just to help you cope with daily activities. That's the first thing. So counseling then we move on to medications. We use different classes of medications. To say SSRI, SNRIs, NDRIs, all these medications, the whole point is to increase the chemical transmitters. I did kind of say about it. Chemical transmitters like serotonin, dopamine. Because normally you get this depression because those chemicals is decreased in the brain. Antidepressants are your medications are the amount. It's just to increase those level in the brain. Now, the mawa say it does takes a while before it works. So these medications could take at least 4 to 6 weeks. And so Dr. Trauma now taking a 1 week now, oh man, who should mejaya? No. You need to give it time. Sometimes 6 weeks, sometimes 8 weeks. I feel who say now we'll start taking count and near now even cry you lost interest and you started doing it. Say a BB said now would the deep so I feel who say now at the DNA ABBA form. So normally treatment is psychotherapy and then medications. All these okay. All these medications also we'll see who say it has side effect. But the side effect doesn't mean you shouldn't take the medications. So we will come back to the side effect if you want me to.
Okay. I was here for na make Kai was said the gawa our jumedi and our suguso no. Make count for kwa at the amount. Nyami adoma kwa man association or more air or more Easter. Into no say open ticket ni be atwa a cool $100. Almost omu ye jumedi at the aboa Kwawu hospitals into a mobile screenings near the Adinina, and penny for say, quite idea fa, Nina, any CK, into Kwauman Association, Siemra, near me support to annual dinner and fundraising no, to help screen our people in Ghana and also the omo jumedia omu ye nti yenyina ye fa ye ni nkochiri mu e se o ticket ni bi atwa numbers obetimi afre ewo flyer no so me de beto so said be ya we ya ticket ni bi ato Mr. John Oten o so o hye yen brother MCOG o so o hye dache hene ofusu agiman so o so o hye ye da simpacho so aba so na wa hye dwumadi no na e de amayen nti se wo asembisa efa depression hu so ultimate do comment eto ase hanom na ye ready e de amaw ena ye ne sister Juliana Domfeh na etwetwe nkomo efa depression hu imprepi no e ya na wo tight obitimi ka me de bia kamadanfo bi de me de aka asem as a someone now diagnose because I didn't come agro mu cry to me because depression ba say ni say na oye intina ya twetwe ho enkomo yi intina say afi na waba so na meka say the gawa our jumedi no na waso eguso no na sister eka treatment ene medications a ewoso empre bebre no yen Ghana for de ye empaibo I bibia be haye bia no ansa ye be bibia no na ye se ye de kwa akobọ mpa ye mi wa ade ne emfa mpa bo ne ho ba bia empa ye ne de wo bebo utu anamo no na wo bo mpa ye emfa ne nyina enkonko ye empa bo nko asa me bisa question bi say depression it may affect young adults na o ka say ai nti almost sa no bi o hono like e bia efi ni twin to the teens, almost in the timid or to a gross society, combine
Yes.
diagnose your one.
Exactly. So no, that would be my next. So risk factors. One of them, beginning late teens to early 20s to your 30s, is number one risk factor for getting depression. All because we drew that age now. Social and social factors and even pressures from friends and family is really high. But it does affect teenagers, it does affect everyone. And if it does, yeah, the same treatment. Yeah, the man penny for no, and yeah, the man and colossal. So it's first it start with psychotherapy, counseling. If the counseling doesn't work, then we go on medication, antidepressant. But normally, almost dosage is a little different from M24. So it does affect kids as well. And the treatment is almost the same as adults still.
Okay. Depression, does it have any link with ADHD and I say and also namne kwanko?
Well, they are all anti-psychiatric disorder. If you do have depression, you are at risk easily to get ADHD. So in a way, it's linked together, but it's entirely different diagnosis or disorder. But once you have depression, you are at risk of getting ADHD easily compared to somebody that doesn't have depression or somebody that doesn't have depression history in the family. Yeah.
Okay, the entire ADHD meaning little one, he's been diagnosed for I think about 5 years or so now. Or it drew so offer into na me say and then no a boy bra or so and so the same path. Thank you for the clarification.
No problem.
There was a form in Papa share program no and from my Mr. Frank Sarpong also or share Nana Srebo Ajuman Phyllis. It was so O'Shea and our sister Catherine could see Papa few. It was so O'Shea. So what's in beside for to comment session also never saw seminar you knew no. Now what you be the Ghanaian Healthcare Workers Association I Trinity Segawa yene Edin Craft for you say any more ebedi apomudin ho enkomo na me bisa say apomudin ho nsem eti say mon jembre na let me twetwe yapomuden ho nkomo sister Belinda ejare also o share nti na me you go back to the symptoms no ebi ohonom a like the mood swings and all that minimum bi ana me ne ye adwuma o honom out of nowhere na wasosu obesu saa o krokro no ba bia enkro ewo mu anso a ono atimi gya na se ebia cleaning a obetimi atwa fie honom nyina yopo nti se eba ne treatment na in me mind na me bi say o yetimi de ade a wani gye ho ana something that you are so interested in e kan therapy a ye de ma woni ho ana.
Well, in a way, not directly. Say, yeah, my therapy is basically a talk speech. When it counseling, daily, it could be twice or 3 times a week. Say, I'll be help you to cope with daily activities. And to say, be or soon they be a therapist, could emphasize that there is no need crying. What is causing you cry? To find out what the cause of the crying is. So it's basically to cope with your daily activities to help prevent that crying multiple times. It's normal to cry when a side event happens, but if it becomes excessive, that is when the problem is. Yeah.
I say, yeah, you're tired, home care no. Like you see all sort of cases. Into the be or no more like and as a near matter so they easily kick you out of their homes. What are you here to do and all that in Tieja Ebanesa yes idea efimu is that maybe sana ebano medication so o can say enkolane penny for mutimi by enkolane the mom on a lower dose.
Yeah. Oh yeah.
Funny say the side effects no. The side effects are penini enya na akran so ebetimi enya.
Definitely. The side effect is almost the same. But normally me catch your patients. The first say one person enya side effect doesn't mean osusubenya the same side effect. Side effect it depends on your body, how you could tolerate the medications. all these antidepressants side effects could be weight gain, sexual dysfunction. You can be said GI effect. Once and I say you are nauseous, you vomiting, you have diarrhea, you might feel hallucination. So the side effect could affect one person, doesn't mean everybody could have the same side effect. Because I always say look at it, the benefit sometimes outweighs the side effect. In that case, you still have to take it, even though you are experiencing some side effect. And also we always could treat the side effect. To say, BB, are you feeling nauseous? We could give you a medication to help with the nauseous. As long as the medication is helping you to at least do your daily activities, go on with your daily activities.
Your therapy, like how long does it take?
Therapy.
Yeah, auto therapy. So, it to me, how long as I wait to me about so and I say be a the auto therapy so the water so forever because and sometimes does it I would say stigma be it me about.
Right.
I can't remember. I said, Lady Bia Minimono, or the Bronx here, yeah, but in the therapy in Brooklyn, no, in her mind, and she feels like, will be who say, or call this officer, the who said there is something wrong with her.
Right. And I think that's one of the problems, especially in our Black community, that we faces, because there's huge stigma about depression. And I always say, just as we have high blood pressure, we have diabetes. You timmy treating or be on medication. So for diabetes and I say high blood pressure, they most likely stay on it forever. And to say, depression, the treatment could be a lifetime treatment, even if it's therapy. Sometimes we might start you 3 times a week. As you're getting better, we could cut down. But the likelihood for it to be a long-term therapy, it is there. And see it to me, and then it's medical awareness, health awareness. If people are aware, say depression is not just a kind of illness. It comes and go and it's just that, but it's a chronic illness and it could be treated if it's well evaluated and there is follow-up, there is medications. Then you could realize that the stigma could be off, or we could take away that stigma and then treat it, and we all live together just as if you have high blood pressure. So if we could avoid that stigma, it is a long-term treatment and it's a long-term illness. Yeah.
Me pacho me do fubi a question amount or see me misa or say depression is spiritual and
depression is not spiritual. I mean, if you are a spiritual person and you feel like prayers and meditation might help, but you need to be evaluated by a medical professional, because depression is a chemical imbalance in the brain. So normally you will fall into depression if neurotransmitters called serotonin or dopamine levels are down. When these serotonin or dopamine levels are down, you easily fall into depression. So it's not a spiritual thing, but if you feel like you are spiritual, you still have to seek the medical aspect and also put it into your spiritual aspect. But to leave it just to say it's spiritual is not the right thing to do.
Yo, mina bema, me jidi say you are no. Ebusia for na meka wo say the gawa our jumedi no e na wasugusu utie na meka wo say all white boat ride no and also eba so the 10th edition afibia ye ko ya to aso edin craft for aya ne pore 10 times into this one there. So wa maybe ana wa ye ho July 5th yenye na ye de ani ehwiremu ne akwa cruise ye kwa kwaji ani said ye no me say nanse me hu say obi am pese obekọ baby because me twa abro ntini un pese mo bekọ baby we so de afi omode ebo no ato fam amayen boko $80 per single and then 150 for couple into no wo try there yenye na yenko to your ticket na yenko enjoy last year kwame UG and ebebo wo honomo this year ye the special guest and so eba into free number C MCOG for MCOG I was have account tickets for DJ Jam I was have account ticket. And I'm also offer me on sabe count ticket. My family glasses into I'm not seeing clearly. It's for a number C nakwaje will ticket 347-350-1857. Ofra early bird ticket no NJB anaye tum into no kwaje the ententem na yenyina yenko cruise embomu. Ofra MCOG on sabe count there and I offer men so on sa ebe count there. So what on bibi na pese edinkra for your bohun dero edemawa and one say obefre the CEO of Edinkra DJ Gem. For DJ Gem ewo 347-350-1857. 347-350-1857. Imprepi no yada metai kan say papa bi say what ton ade na say wa mo ho de ra net say wuti esum na wamu na obi ani ho a obete de wo ton obehu de wo ton no nti say the bread Edinkra for a ye be ho de ro ama at a very affordable price bibia wo ye bia no wo de efa bre ye be ton e de amount ye nya so mu say kikre na che say wo niema no kwa na ekọ me de ma no ka kire wo a wunyini nti wo de afre na be so hye afa say wo pay the hardest money transfer in town eno ne lolly cash omu rate no e wo soro bebre eno ane say wo be promo code Edinkra wo download app na wabo promo code Edinkra omu rate no say as I'm talking and the number say 13 into no so when download do ya LOLLICASH lolly cash download the app no na you will never regret it. And now so download do a baby sa say wo promo code na and one say the Edinkra ebe share so ADINKRA na wenya bonus kama transfers bebre e system num but the magia di the masashe and I make count for the amawe we are the newest in town your friend lolly cash into no download do app na no one say what the promo code mu na wanya discount and omu rate no e was rate no was pa nti no say what they compare other ones you use a ebi mo de e wo form but we no ultimate they send it and as obi so we your business e wo Ghana obetimi asend this account so if you Ghana beto account mu aha no and these are the other ones na we betimi dey asend but entimi emfa mbre wo aha no no this is your business I'm pray bebre no your business na we say no mo atwi ye adi say ya de mpanifo se oni tue mu ayendi nja nti no wa wo ye no na wa wo transactions no ebi efi e call out na ebi nso e ba in nti download the lolly cash app no na nya u discount eno ane say wo bebo promo code Edinkra e de ahyeso na me ka mo say the gawa our dwumadie no e na wasugusu a wutie no yen sister Irene e wo question or say are there free referral resources available to all, especially undocumented folks?
Correct. There are. And that's the good thing living in New York City, especially where so to Bronx, Queens, Manhattan, Brooklyn, Staten Island, those cities, they all have free resources. You could call 311. They will easily refer you to any of these psychiatric or mental disorder clinics. And there are free resources and referrals. Yeah.
Yen sister say obetimi aka or say can you speak a bit more about overcoming stigmatization with depression in the Ghanaian community? We need more education among this.
Yeah. I think so one of the best way for us to help prevent stigma is health education. And I'm really impressed that Edinkra was, open up to educating about depression. I did back when beat me so I and say sorry mo even community African market we should be openly and talk about it, because the more now you're talking about it, the more people will be familiar, the more people will be okay to talk about it. Because of high blood pressure and diabetes, so it shouldn't be this. It should be the same way. So because I'm depressed, there shouldn't be any stigma among it or to be placed on it. Indeed, the most important thing I can say, we should be openly to talk about depression, there should be more health education about it. The more people are known, the more people know about it, the easier we all will be comfortable talking about it. There will be free treatment, there will be free referral, and even if we could help each other, that would be the way to go.
Now, maybe I say insurance, does insurance cover for?
Oh yeah, insurance cover 100%. So or Medicaid, so or private insurance, so or Medicare. Every insurance covers psychiatric illness, whether depression, bipolar, anxiety, they do cover it. Yeah.
Okay. You I was saying for na the gawa our jumedi no and our sugusu uti no. Say some ye bebe ya yebetu to akwan say wokọ Ghana na say wope car papa ademu amobi ehun say oga ona wo be ya na me kan for Christmas auto group e de amount wo frɛ wo mo a car bia wo pese wo dem say SUV say 4x4 bibia wo pese wo bia wo dem bia no wo frɛ wo mo a wo betimi enya car papa akwakodemu enye boga trotro ai boga bi ho no we hu na oni metifo yi princess ho Christmas auto group say omo yi sa ha wi nyina afi ho no mo e de amount frɛ wo mo I can't see my family glasses again. O frɛ omo numbers no e na etwagu e wo screen so no na koje wo de enye boga afi na metime nsesa wo he anasa yi e na se wokofa Uber kra na no so kra ayehu wa wo betimi age car wo pese wo damu na ehu se boga wo na wo be nti frɛ Christmas auto group omo numbers no e na etwagu e wo screen nani no na koje car bia wo pese wo damu na wokɔ Ghana wo anko kyere wo na me ka wo se de gawa awajumedie no e na wasugusu utie no ene ye sister Juliana Domfeh and I actually come your sister, a physician's assistant, and I see which one say PA on a bronze care for and a juma and I actually come if a depression. What church and never be brimu, a quiet depression, if I so bad, said it will be a ubi will be a hornman, nanka and canano, nanka, nanijino, and yomoto hopa, all of a sudden, no jai, be near my way so interested in all of a sudden, not just at the end of the who can now wear food, and near my affect a be or divorce. Bi o hawo juma say never bebre ekoso arabo mu eno so etriga depression nti eno ho nkomo na yedi nyame adom a next week ye the anxiety so eba beto aso but ene de ye see depression ho asem na ye ka depression bebre said na yesi bisa no ye Ghanaian community ni nsem bebre wo ho no a ye nka ho asem because minim say bibi ekoso say ya me be ka che mi nui o de me konam say bia me bodam ba na se me pantuma ba nti etoda na ama because of this stigmatization you know ye di nema bebre ahye ye ho anka ebia me pem ka ekire me nua bi anka obehu ehu nimdie bi na nka wa me direction so ebia say ni say ko hu doctor we na say na ye de ahye ye ho ye behu ana agye nsem na aye too late nti eno ho nkomo na ye twetwe no Ghanaian Healthcare Workers Association ye ni edincrafo yes na watchi bia wapomuden ho ehia yen nti eno ba betwetwe apomuden ho nkomo na bia me ka say topics ye ka ho asem wo hai ebia na deko akoboa wo e wo ekwan bi so ebia na wate but na wonim emu nchechimu ebia beko doctor yi we ka brofo no de ubesori afi ho krampo na won kai de doctor no e kan nti na ye de ato ye ho so se na watwi bia ye ni wabetwetwe nkomo na nkomo bia ye ni nkomo bia ye feel say ye ka ho asem a e ha adwen anase e de ferry anase e de kutwa bi ba beto ye ho e beto ye ho no ye yi sa kutwa no nyina afi ho no nti eja.
Yeah, and me person cast risk factors for depression. One of the risk factors for depression is earlier to be a female. Women are normally diagnosed two times more than men on depression. Obi bebusa say adenti na ema are diagnosed because women are easily able to express our emotions. That's number one. Yet me say bibi enya we ho a yet me call your doctor ho am I a diagnose or evaluate it. And in that case, no, we have a better data for it. Unlike men, they barely goes to the doctor, and there is no much data on that. Also, one of the other risk factors, it could be alcohol abuse. So it could fall into depression. Even recreational drugs. I know now marijuana is legalized, but if you abuse it, Cocaine, if you abuse it, it could lead to depression. So obi or chronic illness, say bad cancer, say kidney failure, even stroke, heart attack, obi go through body aches or pains. Those could be a risk factor. So they be you are in pain while isolated or suffer. It could fall into depression easily. Say obi or be a lesbian or gay because of the society, how we look down on it. That person could easily fall into depression. And as I said, we will be our low self-esteem. You could easily fall into depression. Say, what was strong family history? Say, first relatives. Say, your mommy. Say, your papa. Say, your nuanom. So, what these relatives are, our depression, you have a higher risk of getting depression. And as we a teenager, late teens to early 20s to your 30s, it's a risk factor for depression because social pressures from friends, from family, they could easily fall into depression.
Okay. I was saying for depression, and come on, and I chicken any mammy be a minimum. I say, ne buy a ray, and now ne banny film, no, ne banner a close pa, into a man, ne banny film, no. I said her world turned upside down. Inti no said that me kind of Ghana for be the empire bo. Tinanka as a senka ne mana ka na ni ko ne hona your friend say o mo be pe e ya ma no ye no empire bomb pie ba fe du baby no na aye as a agensem. That being said, ye de no echo Ghana signed ne ba ye afe inti afe ansana yehu say a depression inti sa no e ba ne sa e hye ho cha etimi like the treatment no etimi kontem sa e ma wana say ye no etimi yes say you combine medication and therapy together.
Oh yeah, depression treatment is always first thing will be psychotherapy, which is counseling, and then treatment. But to come back to Nyaoka and grieving, right? Everybody grieve. You know, any catastrophic event happens in your life. Excuse me. It's okay to grieve. You lose a friend, you lose a family member, you will go through divorce. You even will be a crumple or lose a job. It's okay to grieve. But there is mild grieving and there's complicated grieving. And so we grieve for the first 6 months. It's okay. It's a nipano who says ne hon tise ne no wati or daka kra broso oni dikese ne the way no sike kane hon afi de onke kane ho biem and na afi as why isolating ho. So our family members and our friends around that person they should be able to point it out. And it comes back to health education. Se nipa no ote wonchen, they could see the symptoms of depression. They could easily point it out. Say, okay, minia, near me who say near maybe assassin, my young doctor. Now, but say or nipa ne mu who say we depressed. Now the family members around him, as soon who say we depressed. That's when that depression. First 6 months is normal. After 6 months. That is not normal for a person to grieve and I feel isolating and also with me da bros one sorry even a dreamer cry warrior no it's affecting their daily activities. That is not normal. That person needs to be evaluated by a healthcare provider.
Me pacho be a question Emma or say how do parents identify depression in their children so they can seek proper help for them?
Okay, so the symptoms of depression is similar way from kids to the same as adult. But for little kids, one thing I noticed is that the kid becomes very irritable. I say nibufu intem, and then they get upset easily. They also even a tiny matter now bones and nibuafu. And then it goes to school. In school, they will not pay attention. They become very destructive in class. They get into little fight from, with friends, from classmates. That's one thing we notice about kids. They get tired. Their thinking process changes. They become very troublesome at school. So when, as a parent, or even if it's a teacher, need the report to be bad like that, as a parent, put 1 to 1 together. And if it's continuous, if it's more than 2 weeks, 3 weeks, there's the need, your healthcare provider ama or evaluate for depression.
Yeah, but young teens and young adults, you see, that's depression affect their learning abilities, Anna.
Oh yeah, exactly. It does. Also, depression affect your thinking process. So it definitely affect their learning ability. It affect how they concentrate. It affect even the ability to even sit down and listen. They become very irritable. They would distract the class. They'll probably be sleeping more, even in classrooms. So it does affect their learning ability a lot.
Yo, it was for the Gawa our Jumedi, and our Sugusu Uti. Depression was him na ye king, say what baha. Say spiritually, Uberson daye, basa basa, na se bi obi ne wo da, na se mo bi air pamo. Make for helping hand hearts at the amount. Information in a HG ever screen nesono. O frɛ wɔ mo ade ɛkɔ so bia sɛ yɛ obi na aware wɔ honhom sɛ yɛ da yɛ basa basa sɛ de meka yɛ no ɔmo bɛboa wo ama bibi biara ɛkɔ so ɛwɔ wabrabo mu spiritually no wanya wo fa ahodie enti frɛ healing hands number no ɛna da screen ne so no o frɛ wɔ mo a na oni omo twetwe nkoma omo beboa wo na omo ayi wa fi saa ohaw yi mu the Gawa our jumedi no na wasungusu a uti no meeting editing na Sarpong, the host of the Gawa Hour, and your sister Juliana Domfeh, and I twetwe nkoma efa depression ho yen sister a PA ewo Bronx care wakeka ensem bebre na atwere yen so wasem bisa ubetimi edo question at comment section no so na yeyi wa no yen sister Victoria yebo a o so a o share yen na very matenten gram na asiedu da kon onso wo so a o share yen sister Irene Asamwa ewo so a o share mbacho o say okay obi na ebisa asem na obi na no ewo ase ho afa referral
Okay, so
yeah.
Yeah, near me pessimism kind of say complication of depression. One of the complications could be excess weight gain. Also, we depressed, they tend to eat into obedi design. It tends to be weight gain, and another complication of depression is social isolation. No, what home many pem or man family home, and I say excess sleeping, and we say self mutilation. Once a nipane katene home is very well known in among teenagers and kids, or the obephysis or any knife and then cutting themselves. Even premature death, sometimes to suicidal ideation. Once and and symbol and even hallucinations. So or TTB and now maybe anyhow. Those are some of complications of depression.
Okay. Your friend say hallucination who asem me say yeah you home care near my you no enya asem kitu there was a time bia because ye adwuma bi na me fi ho no na the patient was okay me do via your friend me say she's doing this, she's doing that, and I said na me am friend me here sana wa mfa ni medication, ni depression medication. What skip a drone it may affect in any way, Anna?
Oh yes, it does. So it also could be say how many times the person has skipped. If it's just 1 or 2 doses, you probably might not see the effect. But if it continues for a couple of days, definitely you will see the effect. Because all these medications, believe it or not, it does work. It does change the neurotransmitter it will bring in. It increases those serotonin, it increases those dopamine, and it works when you take it consistently. When you stop taking it, maybe 1 or 2 doses, you might not see the effect. But if it continues, yes, you will see the effect. I feel now bones and nipan hallucination, so yeah, it does.
Does depression have a cure?
I think it's manageable. You can't completely say it's cured, so I'm off the medications. Just like high blood pressure, just like diabetes, even though in a good circumstances, diabetes could be manageable and cured, depression, it could take a long period of time. So the person have to be on this medication for a while, for a long period of time. So it's really hard to say it's curable. You could manage it and you could work around it and do your daily activities. Even if you are off medications, you got to go for counseling. You cannot stop both at a time and say, okay, I'm done. Once you're done, the episode just comes right back again. Yeah.
Okay. I think in my mind the reason Tiana yemubi yempese because I feel like you do to a drone so like ube fedrona for the rest of your life. And until I be a yemubi yesuro say yebekono. Me started say me host to the Gawa Hour program na ensem bebre ohonoma. I feel like said I'm from me hosa, but after the me started say me host the program any the feedback me nyano ewo like after program say be mo frame ye di nkomo no. Na me hu say even one kasa kra no e to da say ultimate counseling, me say my schedule be it's nothing.
Correct.
Just go.
Correct. Yeah.
Nako bisa. Bia bibi koswa enkomo a woni o doctor be di no. Eno ho na ye behwe so ama o treatment. Nti no me start ye no me hu say my schedule my appointment. Me
That's
be ko.
good. That is
and
good.
It's not a bad thing.
It's not at all.
Nti no yesra mo ebusiafo ewo mu a said ye kita phone ha ye kakra bia phone ni here maintenance. Ya dwen no so here maintenance. Ye car here maintenance. We have to work on our minds also. It could be a little baby quite back okwa you catch us a meditation be
correct.
And I say be idea when it je hu bi koye ubetimi afa so kwa de asua bibi because minim ma maybe na mehwe na ono through ne therapy a okọ ne ade no say oye crochet otimi ewu nie ma say ko oye na je so be ye bi kuraton intine through that no ni obi kasa ene ade no utimi kura e de fa so e di hu bibia na say odisua bibi inti ebusia for say me pamcho you say obi wa question ma say if the medication has side effect, why should I continue to take it?
Okay, yeah, that's a good question. Bibia ya numbia was side effect. Even water ensure good. But unom no more ejina wo body name e ma wo say wo yeah wa ho because edema. Yeah, so everything has a side effect. But I always tell patients, you got to look at it this way. Does the benefit outweighs the risk, right? The side effect, now we have good classes of medications, and the side effects are simple GI effect. So feeling nauseous, we could give you a medication to treat that. So even if you are vomiting, we could stop the vomiting. If it's diarrhea, we could stop the diarrhea. And he said, if we could stop those simple things for you to get up and do your daily activities, for you to feel yourself, I think it's worth it. Bibia has side effect, but and I start to because now when your side effect, we could change it to the other one. And there is the need for communication between you and your provider. So okay, we say, mommy, side effect. Is there anything else that I could take? And normally we could switch it around. Yeah.
Yo, yen sister Ivy Blue, was so O'Shea and I am my man, Teresa Sarpong, was so on also O'Shea. Your mammy said, "Nedia, why you late? But when you late, so I send be say be out to me, Eddie, by mammy Teresa. Now you are not Eddie amount, and there your name, yen sister Juliana, and I education come out for depression home. In prep, yen Ghanaian community in same say no, ye must so and ye bosso said ye be ye never die ho so e bia na wo mood swing bi e na esesa ana say nsem niam bi e koso na say odofo bi e niam bi e ko no so a ene ye hini sa pon no e de ama ho na ye mfa ye ni nto ho ye mfa ye ni nto fom especially ye teenagers yi omo sorry asese omo ne ye kra nkasa bi mu o friend no phone so a friend 100 times one fa enso nya texting na no wa answer and almost they go through a lot because almost school work and all that and easy and ma womo into no minimum colebia e do so say oba be exams are not like wa bottle
right
until say exams ni betwa mu no ayam hihie ne ade na make say ye nyina ye hia maintenance for your adwene ade randomly Wait me the back or say and check nana.
Oh yes, absolutely. Yeah. Ubetimi the nako. There are so many facilities. Even if a winning insurance offer any of the city hospitals, say a Lincoln, say a Jacobi, say a North Central. All those facilities would evaluate the kid easily. And if there's the need for medication, first of all, kids we normally start with psychotherapy, counseling, and they will be open to do that. Exactly. And before that, me person talking about prevention of depression.
Come baby sir.
Yeah. Even though we might get this depression, there are ways we could try and prevent it. One of the things are stress. If we could help and control or cope with our stress, so be how especially a Ghanaian community, even within marriage, a lot of people are going through a lot within marriage. No, see what not the It's okay to get therapy. There is nothing wrong with it. To me, even if it's we a spiritual person, say your pastor, any community leader, or healthcare provider, say or doctor, confide in someone, even if it's a family person, confide in them, because technically everybody needs therapy. If you could have a therapy, because we all go through stresses in different ways. So number one is for us to cope with our stresses. That could be a way to prevent it. Reach out to somebody. It could be a way to prevent it. Call 911. Likely we are in America. 911 could easily bring a provider to you. And then there is a number 988. You could test, you could call 988. Always have healthcare providers. Either they could talk to you directly or they could send ambulance to come get you. So the help and the resources are there. So Mama, you utilize it to prevent depression.
Yes, sister said the help and the resources are there. Ade ba come who a Ghanaian community ni say adwuma ye no yetua insurance o yete insurance fee akatua mu every single week. And so sabeya ya de beko hospital nimpo no ye ni adaje ya ton time ni nyina edeji overtime nti mprempi no enema ye too late ema yen nti eno nti na Ghanaian Healthcare Workers Association ye ni edincrafo ye se ene mo betwetwe sankom we na watwe bia dwumade ye no wukuada anasa ya wada, but depending on the availability of your guest no ebetimi aye days no ebetimi a change. Normally nka mama wukuada nka meba ya wada ba ene na yen sister e available nti na ne etwetwe nkomo ene no se de bidi kan kan no se woton ade na pese ye bo ho da ro ema wa wetimi afre the CEO of Edinkra Radio and as a MCOG na woni omo akeka ye bo oniema no ho da ro ama kama ye kan ekọ nti no anase obefre 347 3501857 347 3501857 frene mo uniema ho da ro ema na me kan for Kali cash the amount. So pesika money aba edwaman so omu rate no ewo sora eno ane Kali cash. Download the Kali cash ewo the app store na omu rate no ewo soro. O download o maybe sa promo code eno ane se obebo edinkra de ahye so. Se ya no $1 is $13 ewo Kali cash. You know, call other ones na enusa. And I will say no hassle be answer any home. App ni be your ma download do and also cross sebe ya obetimi rem na and also akoye watch bidin. Obetwa wo ho sa way is so simple, so easy to use. Inti download the Kali Cash na kwaje u discount bocho omu rate no so e was sro kama. Afi say August nyame adomo a April 6 make for Global Mothers Touch at the amount say Black Heritage Fashion Festival. Afibia or ye edeboa sebi inyanka any ewisia a omo Ghana. Ebia na o take it back o awoto ebetimi ato empaboa anase bag e de amakorabi e de akosku. Akorabi o hono ma otimi hu se onimu ade kama na so oni oboafo a oso na sen. Eno nti e na Black Heritage Festival e de ato omo ho so. Nyame adoma April 6 ye omo se nyina fa ni nchiremu e wo 3586 Boston Road e wo Bronx he ya. Afi ticket no $100 ewo VIP and $70 and so regular stand. Nti to ticket ni bi ni nyina yen ko support to this good cause I sister Eddie ato ne ho su. So person o ye cash app number no albesi so 646 465 4384 646 465 4384 and I said 929 331 8560 Fre nato ticket ni bi ni nyina yenko ne yemfa ye ni nko chiremu events bebre o hon ma meye 6 p.m. sharp na red carpet no asha ase if you hon mo ko nyina enije nko a nti from 7 p.m. to 12 a.m. any the main show no ye nyina yenko so pa hwene papa bi de agugu wo nsa na se di bi agugu wo nan a wo ba hon ma obenya bi ato to support the Global Mothers Touch initiative no. The nyina yemfa ye nchiremu August 6 na ye nyina yenkonko support so. Kama last year me ko bi. Almost share for na mente ne nka enti no manko bi nti last year me te nka na mesumi ya me de mani kwa kwhye se de be ya menya bi aka ampara me de mani kwhye na afi enso mbehia me ewo honom nti ticket no afi omo atete so se shishi de amayen VIP no 100 and a regular no $70 last year nebo ne wosoro but afi de o se o de to form boko de amayen se de be ya obi abetimi after ticket no na be support Jumedie no the Gawa Hour Jumedie no and our sugusu a uti no me de Tina Sarpong the host of the Gawa Hour so openku papa asra ama already no ato so kama so ye kokko so ye tuntum so ye chocolate eno ane Arcas organic mixtures for Arcas na kwaje odie omo enku no empopo ho se sama ebebe wo sha ase esra me ma sha ase esra ntina medi ho adanse for omo 917-836-3155 917-836-3155 na kwaje odie ade a eye me de ewo ho ne se baby awo bia no obe ono abetu card abehye wonsa ana se wo kwan ewanso a obe meli e de abro kama umpe we na apede o de ka cha ne se promo code dinkra o discount bochu nti je wo de wa package no very very nicely me yesa me de the package ni be ba na me refi said the package no unji ndi kra po se enkuinga na ni na f kama na wo de sra nso a wa be hu se wontu usika nwuye Arcas nku masra emema nso sra ntini se wo penku papa de asra eno ane Arcas organic mixture na me fa kwanya we so Echia, the CEO of Edinkra Radio, and the executive producer Emma the Gawa Hour Jumedie DJ Jem. DJ so also Michelle Bebri inti se afi and our baswa enche ye be sorry so asim bisa utime de was question to the comment section no e de mayena ye you are no na me fa kwanya we see so e we hye in sister Edith Davis and sister Jackie Adokui a happy birthday gawa fo am birthday eto so much bonds ni nyina ye mamo happy birthday in advance and happy belated birthday. Nti nyame adoma say wo birthday do so na say esi program da no so a we shout out to nkwa de ye de be ma. Nti say o asembisa na webisa na ye you are no ye ni sister Juliana and a echechin komo efa depression ho bebre and a sister aka bebre and a wachechemu e de akire yen or say so New York nko ade a ene na wa witiri onya frɛ 311 say kra no you don't even have to go to the therapist no and one say numbers na wo ti train ma hu numbers ni bi wo bas ma hu numbers ni bi wo adwuma mu kra na you can still do your therapy nti esrɛ mo a sɛde ye nka sɛ ya sɛ de kan ka ye de ka ne kɔ ne akɔye maintenance ama no wo TV sɛ ya wo de kɔ ne aye maintenance adwene no so hia maintenance nti enyina aye nkɔ mesi mebuku me de nso buku de ne enyina aye nkɔ wo ye no wo tu ho anamo no na o de mpaye nso eta ye akiri emfa mpaye na de anamotuo no abeta ye akiri and wo empaye no de ebeboa na emumu no entimi enyi emfi hono ma okra nti no yen fa ye ni nkyere ayare sabra na se yen ko doctor na doctor enhye yen ye hu busy obi ohon wasese adwuma be miensan nan ne nwotwe e de agu ne ho so nti time kra wo de tena se e de ato e de adidi kra onya ono a onko check up ono a chese bibia obehu a one day person gone too soon one day person ni pass mercy yare onya stroke da hono ye besre mo ewo mu se ye pesika de nanso etoda ye ma wede na ye de pesika no ono so onje na home kakra because hours ne de obebo ubo hours ne saa na wanya time ama ho a ubehu ana one day pe na fe adwuma na udi mrike ko na wontimi kra nsore e na wakọ adwuma no ti ye besre bebre ye mfa time ni bi ensa ye ho yare ye mama Teresa Frimpong or see keep up the good work ye da si bebre e na your sister Nidia Hodges or say yes wonderful topic love it I learn a lot. Depression is very serious disease.
It is.
Thank you, Sister Nidia. Listen to and I make for Edinkra All White Boat Cruise at the amount. The 10th edition. Tickets no abba. Say no your early bird ticket $80 and $150 for couple. This upper single 80 and as a upper couple so $150. One top mo tickets in term and sana yato ebunumu. Edinkra All White Boat Cruise, the 10th edition. Pore in fear edunye and omodi the jumede abre. A lot of times no be a honor omo ya endru baby ya but Edinkra for see ni gye ho asem ehia ye nti no mo afa so mo ho se afi bia edu sama omo de ye bekọ boat cruise eno achi November mu so na omo de Edinkra Heroes Excellence Awards no e de abreye ni se woni mo bi a obo ne ho moden se ye ha se ye Ghana se wo bo anyanka na enwisia ene ekunafo anasa ne potem wo hye obi school ni ade ade a ubetimi afre ubetimi e de ni din e de amaye ne ya hwehwe se nipa no qualify say say man no sa abasobode na ye the Heroes Excellence Awards no e de amano free 347-350-1857 na nominate you be which mean nominate as many as you want but you verify share na se nipa no qualify there ye the jumedie no ebema so wo ko Ghana na se wo pe car papa demu atwa me hu se wo gaboga wo na wo be yi a na me kan for Christmas Auto Group e de amount omo so omo cars car bia wo pe bia ebo no so eye fofofo nti yemfa ye ninchre Christmas Auto Group ne nkoje yen car wo kwa wo be hu say yes say 4x4 say SUV family car and a wo pa car bia wo pe bia no omo wo bi wo hono mo e de ma afa su kwawu my association for omo say omo invite yen to omo annual dinner and fundraising into no almost donation fee $100 echo ticket no so 100 time no 6 p.m. to 3 a.m. April 6 into April 6 ni jumadi mienu enegu yeso ye to ticket ya kwa support so afibia omoye e de boa se ebubi ohono magana or diabetes nanso na onim nti omo cheke hwe na se wo bi a eduru ese ye de ma wa na se de ese so omo ye de boa bia no ombeye e de aboa mpanifo se e kwanchan ade e fa ne nyina ne sikai kakra obeyi di aboa ne kakra mesuma yi di aboa ena epushi jumedie no ema jumedie no kama na meka say the gawa our jumedie no ena wasugusu a utie sister Juliana enche ye be sorry so there be nkransha na se futu sem ena ode be jaye ansana ya sorry so
okay so the American said depression a mood disorder affect how you think, how you feel, how are your daily activities. It's very common. 1 out of 6 BI is diagnosed with depression. Meaning, one of them will be diagnosed with depression. CDC MIA who says 16 million people will be diagnosed each year with depression. So it is an illness just like diabetes, just like high blood pressure. Ain't evaluated for depression. So we'll call any stress and tnase enya Go see your healthcare provider. Get evaluated, get the treatment. Even though say even there is side effect, manage it. Speak to a healthcare provider. There is different kinds of medications and it's all treatable. Now when you help it's just a phone call away. 911, 311. Even there's 988. You could easily test and the help and resources are there until Mumayin utilize it. Luckily, we are in America. And for luckily, too, we are in New York City. Help no. Let us all utilize it. Thank you.
Your sister say help no ewo. Let us utilize it. Yemfa yemma ye ninko ya pomuden ho eno na ekrekra nipadua no eno na ekrekra yemma obi oho ana ne mesa obi ho ana wan hwe ne ho so yi na oja enkra no ko na enkra na wo ye se wo bre ahwe wo mo no na watwa wo nkwana so nyame adom a next week ye ba beto aso depression a topic a won say me kra me ka ho asem na say aboto me kakra
Yeah.
because say it goes a long way. I know a lot of people going through it. Me home care. Until I deal with a lot of cases. They have depression and all that. Until this topic is so personal to me. And until I say, Maboto Sano, Nina ne say, one so ubenya emre edi ama ho. Say the sister Kayano. America had no omwama enema aye. For amayen, you don't have to go to the therapist. You can do it over the phone. Ejuma mo kra no say o ka echere wo mo a, they give you some time off and the akeka ho ni nyina. Nti no the therapy is needed. Wo ya therapy no na wo de mpaebo eta ye chiri na enuro no so e de obeto so no na eno so onum wunu. Se de be ya wo benya apomuden no. Nyankopon ehye 70 years and de ma yen. But 70 years the new obi aneto no. Nti no wo na wo behwe wo hu so yie na wonya sa 70 years no wapomuden ho nsem ehia yie eno nti na de gawa awajumadi ye ne edi nkrafo yafa ede ato ye ho so nti enche pie ye be sorry sister Juliana chiadofo na ebusiafo na ya sorry so
Yo, machia mama.
Ochia ebusiafo.
Oh, shout out. Okay, I want to give a shout out to my husband Richard Amankwa, also to all my family. I want to give a shout out to my PA colleagues. Keep up the good work. Go PAs, we rock. Thank you.
Sister Juliana ama me kon kra do se me so me PA ni bi nti enche me so mbe hu ana me so me PA ni bi ebusiafo ele ahana emrebe ma ye ho kwan ama ye de gawa awajumadi no ebisi ansa na no me so mechia me papa Mr. Frank Sarpong na me mama Alice Osei Mensa MCOG na DJ Jem dache hene ofosu ajeman also Michelle Bibri nyame adoma ya channel pa de dache hini show no ebeba so anopa bia se open cranche sem open nika se open Ghana nsem atia eno ane se odi radio no beto edinkra multimedia say your Facebook say your YouTube and I say your TikTok edinkra your all the platforms ne so dache hini from 10 a.m. to 12 noon edinkra sem ebebro enika sem ebebro and I feel Ghana nsem me da bia so MCOG on also or the political bench ebe brain I so we need politics ho a nanka enka ne me over politics din ana me dwane but me started say me share political bench no I'm having an idea of what politics is all about nti MCOG so from 2 p.m. to 4 p.m. or the political bench no ebe brain adechi kwesi ada wasan the showbiz so e de abrain ukwada me so ubehia me e wo ha no 7 p.m. to 8:30 p.m. na yede the gawa our jumadi no e de abremo na najwa echuma mansa mechia wo baby a ubia afi so me amedoba Christiana Ashrifi nyame adwa next week Saturday o birthday bash no nti enye de ni bechi mu ha no ha ene na ye di jumadi no ebesi mi de niti na Sarpong nyame adwa de se na ye besan ye hiem akram
Bye bye.